Hi, I'm Han Brown, the host of the Boomer Living broadcast. On the show, we address topics that matter to baby boomers. Thank you so much for joining today, and we're excited that you're here. So please participate, ask questions. You probably are passionate about this topic, and that's why you're here. So please ask away, and we'll do our best to answer your questions. And thank you again for joining us. So, for the folks in the audience, let us know where you're calling from or where you're dialing in and what industry that you're in. So, today's topic is behavior science, the key to better patient outcomes for baby boomers. Imagine for a moment that you've been diagnosed with a chronic illness. Perhaps it's diabetes or heart disease. You know that if you don't take care of yourself, the consequences could be severe. So you diligently follow your treatment plan, checking your blood sugar levels or taking your medication every day without fail. But then one day, life gets in the way. You miss a dose of medication, or you forget to test your blood sugar. It seems like no big deal at the time, but soon enough, you start to slip into old habits. And before long, you're back to square one, struggling to manage your illness. Well, and that's where behavior science comes in. Behavior science is a study of understanding human behavior. It helps us understand how we can change our behavior for the better and how we can make lasting changes in our lives. It's not easy to change our habits, but behavior science offers us a roadmap for success. And with enough patience and effort, we can overcome obstacles and achieve our goals. So, if you're struggling with a chronic illness, don't give up hope. There's help. And with the right tools and support, you can succeed. So, today, my guest is Johannes Basco. Johannes has always had a fascination with the way things worked, how molecules interact to create physical and chemical phenomena. This curiosity led him to study chemistry at some of the world's most renowned universities, at Zurich in Switzerland and Harvard University in the US. After completing his doctorate, he then joined the business development team at Observia, where he works on bringing innovative patient support to market worldwide. He's fascinated by the ways that technology can improve people's lives, and he loves working at Observia because it combines his passion for life sciences with an interest in cutting edge technology. So, Johannes, welcome to the show. How are you?
Pleasure to be here. I'm doing well. Thank you so much for inviting me.
Yeah. Well, thank you. Where are you calling from and how are things over there?
I'm calling from Switzerland, right in the middle of Europe, right in the middle actually of Switzerland, close to Lucerne. Um, yeah, we're having a little bit of a cold patch, but otherwise doing fairly well. Pretty happy here.
Yeah. Well, good. Well, hey, congratulations. Congratulations on your new addition. I think last time we talked, you had some exciting news there.
Yeah, well, it's still 2 months away, but yeah, I'm having my first kid hopefully soon.
Great, great. Okay. Well, please share with us who is Johannes personally and professionally?
Really happy to. I mean, you mentioned a lot of the things in the introduction already. So I did have that interest for how things work. I think that actually started relatively early. Then going through chemistry and doing very fundamental and very very difficult to explain research, which was interesting in and of itself. But then I started moving more to the sort of business world, and now I try to apply actually the same kinds of concepts because these things are always connected um, to the approach that we now also have within behavioral science, within patient care, and within the healthcare system at large, and specifically then also on how technologies can actually help in that realm. That's just me in brief.
Well, thank you. Thank you so much. And thank you for your time to come here and shed light on the important work that you folks are doing. We talked earlier when there's chronic illness and habits, breaking bad habits, they're intertwined and it can be very severe if we're not able to do that. So I appreciate the work that you do. So let's talk about chronic patients that have difficulty adhering to their treatment plan. due to underlying issues. Now, people have a lot of trouble following their treatment because they don't understand why they need to take all those pills and shots. Can you explain what causes chronic illness and how does that affect the body?
I mean, chronic illness, that's not necessarily my forte, but like generally speaking, we talk of a chronic condition whenever something lasts with you for more than a year. You've mentioned some of the typical chronic conditions already, right? Like most of them actually will last until the end of your lifetime, like diabetes, like asthma. But then certain types of cancers fall into that condition because it takes a while for them to get cured, or there is no chance of curing them, right? And it does impact your life. Um, the impact that it has varies obviously by the chronic condition. We're pooling a lot of different conditions here into a single pot. But the key to understand is that it will have to become part of your life, right? There will be more frequent doctor's visits. There will be, as you mentioned, tests or medication that you will have to take continuously. So the key about a chronic condition is that you cannot just bridge over it. You will have to identify with it at least to some extent.
So, most people would rather live a life that's comfortable, even if it means taking a few shortcuts on their treatment plan. So, why is it so hard for people to make healthy choices?
I like that you used the word shortcut there already. The human brain is fascinating, right? And human behavior is fascinating if you think about it. If you'd have to make every decision in your day, where you walk, how you walk, where you look, and so on, like everything you touch, if you have to make a conscious decision every time, that would be overload. Like you would be overwhelmed all the time. So the way that the brain works, right, and the way that we learn is basically we rely a lot on our intuition, and we form that intuition. You touch a hot plate once, you start realizing, okay, this is hot, I have to pay attention. The next few times, you're not going to think about, oh, is this plate hot? Can I touch it? You'll instinctively know what's going on, right? And that's the sort of feedback that is important for us to learn from. Now, obviously, in healthcare, that's a lot different than in health. You don't immediately feel healthy when you take your medication. You don't immediately feel healthy when you do exercise, right? So all of that feedback that makes you feel better and that is positive falls away. And that's why you just don't form a good intuition about your health. Somehow you do, right? When you stick to some certain things long enough, then they become a habit and you start feeling better. But it is a tough path to adopt these kind of behaviors. And that's like, it is inconvenient to pay attention to your health at all times. That's an unfortunate truth.
That's very true. And chronic patients often feel like they're being judged by their families and friends because they have an illness, an ongoing illness. So how can we help reduce the stigma around chronic diseases?
Um, yeah, that's a tough issue that you're highlighting there, right? There's two sides to it. So from the patient side, what I can typically say is often that is actually overstated. Actually, we're more scared of that stigma than that stigma actually exists. Now, I'm not trying to downplay anything here, right? Like if you feel that way, then you feel that way, and that's your sort of issue. But then on the other side, also, it is underestimated how much that can actually have an impact. So that means the only way to really do this is to talk about it with your family, with your friends, talk about it in the situation that you're in. It is in both directions, really misunderstood concept that stigma could exist and how that stigma could be impacted. But fundamentally, you have to be aware of the fact that, well, we say chronic conditions, right? I think in the US right now, we're way over half the population have at least one of the 10 most major chronic conditions. So that means it is pretty common. So any chronic condition really cannot have that much of a social stigma because you're in a pretty large boat that covers about half the population. We also have to be aware of the fact that when we talk about treatment plans, so when I talk about treatment plans, I talk about adherence. So you have to take your medication as prescribed. You have to fill your medication and so on. But it goes a little bit further. It also means that if your physician, if your doctor gives you specific recommendations on what you should and should not do, that you follow those. And that you follow sort of the pathway that is meant for you. So visiting the doctor and doing the checkups that are sort of recommended for you. And with that entire concept, right, we still know that around, again, half of patients, every second patient actually has trouble doing that. So with that social stigma and being afraid of it, again, you're not alone. That is a pretty common thing. It's still a problem, but it is not something that is just faced by you.
It's true. You sure feel like, you're alone. So, okay, so let's say many people with chronic illnesses feel like they're a burden to their families and others. So, what do you think are some ways that we can show them that we care without making them feel pressured or a burden?
Yeah. It's it's interesting. These negative feelings are always very destructive because they tend to close you off, right? Like if you're a burden, you tend not to over communicate. If you're a burden, you tend to under communicate. So it is a little bit of a vicious cycle if you think about it. Our philosophy typically is whenever we work on programs, whenever we configure or develop new programs and set up new things, our philosophy also for caregivers and for physicians and for anyone really is you can only help the patients help themselves. And that's something you need to keep in mind. You will never understand sort of what a patient is going through. Even if you had the same condition, there's always some personal traits. So you will never quite understand that. So staying open with that, being empathetic, and trying to understand what is going through with the patient, being supportive as much as you can be without actually pushing, because that's the most important part. Remember that whatever behavior you're trying to change, whatever you're trying to elicit, is not going to happen by you telling that person they're supposed to do something like this. That is just not a good way.
Hmm. On a personal level, um, I have loved ones that I'm going through with that are dealing with dementia, Parkinson's, some form of cancer, diabetes, high blood pressure, you name it. So I put myself into their mind because I see it. These are my siblings, my parents, and I know that I understand why patients have trouble following their treatment. Sometimes can feel like they're a failure because chronic illness it is overwhelming. You're giving a long list of treatments and told that you need to take medication for the rest of your life, and it feels too much to handle. So, you quickly become discouraged, and you don't want to be someone who needs medication just to get through the day. You want to be normal. So, as a result, you have trouble sticking to your treatment plan, or you skip doses or forget to take your medication altogether. And, every time you fail, it feels like another reminder that you're different from someone else, from everyone else, and that you'll never be normal. So it's easy to feel ashamed and needing medication, but I believe strongly, even my personal experience, that there's no shame in being different. Because eventually you come to a place where you're able to stick to your treatment plan, and then you realize that taking medication doesn't make you less normal than anyone else. Actually, it makes you strong. And because you're fighting for your life every day, so that's why it makes you strong. So can you talk about why is it so hard for some people to stick to a treatment plan?
Yeah, I mean, you highlight the excellent points. The first thing that we have to be aware of, it's hard. It's not like, you're a conception that we had in the past was you're in the physician office, the physician tells you take this medication, this and so often, that will just happen because that's the way, an authority tells you to do it. That is not the case. Doing something without understanding why you're doing it is just inherently difficult. It really is, and that's often underappreciated. So the first thing we have to do is we have to acknowledge that fact, right? The second part is it is not really a failure, and it is not really something that is that you failed of doing. As you mentioned, I like the way you phrase, and I appreciate you sharing these personal stories, because fundamentally we have to understand that it is also complex. We can go into that maybe a little bit later, but we have to understand that every person is a person and not a patient. Yes, when you have a chronic condition, these two, like the patient, will sort of have to be incorporated in the person. But first and foremost, anyone is still a person with their own situations, relationships, issues, challenges, and also opportunities, like in how you want to live your life, right? As you said, technically you want to be normal and you want to be standard, but that's just not going to happen. Now we're using the phrase normal here also. I'm very aware with a little bit of a connotation because, again, over half the population, then the majority therefore actually has a chronic condition. So being normal, we could argue actually which is the normal. But whenever we have that feeling, right, that negative feeling of, okay, I'm overwhelmed, and we have to understand that that is actually normal. There is probably no one who comes out of the physician office like, oh yeah, this is easy. I'm super happy with what just happened. It is the fundamentals of what we're doing. The negative feelings and all of this, you should actually take that. That's actually one of the strong motivators, right? Like, this is feedback. This is feedback about your health. You don't feel good right now. And this is feedback that I mentioned before in the intuition that we can actually channel to develop more positive habits about it. As you said, you'd have to stick to your treatment plan. You have to find ways of making it work for yourself. Or alternatively, very often it is underestimated that you can actually talk to your physician about exactly these issues. There might be other options available. There might be more explanations that they can give you. Now, I'm not talking about the time of diagnosis because we all know we're overwhelmed at that stage. But later on, don't forget to mention the sort of concerns that you have with your physician. Number one, because that physician might otherwise draw conclusions that are incorrect if you're not taking your medication, which won't be positive for you. But on the other hand, also, that physician might be able to adjust the treatment plan, might be able to give you a little bit of additional help, and make sort of ideally put you in a shared decision-making scenario. So they will work with what's the best option for you based on your specific situation. When that has happened and you're at the optimal point, there are still things that you can do in order to cope with it. There are sort of digital solutions, but there's also a lot of people that will help you. Again, you are somewhat special in your situation, but you can count on the fact that somebody has gone through, a lot of people actually have gone through the exact same issue that you just went through. And a lot of them will have shared some of their experiences, some of their learnings, where you can learn from. So it is actively seeking out that help that can make you more comfortable with your own condition then as well.
Mm-hmm. Here's another reason why people don't follow their treatment plan. I don't have chronic conditions, not that I'm aware of, but I have trouble doing this. Side effects. People don't take medication because of the side effects. I don't take certain medication because it's just hard to swallow, or has a bad aftertaste, or it has some side effects. So give us some advice on how to deal with side effects of treatments.
I am not a medical doctor, so this is obviously a little bit tough. You're absolutely right. Actually, I can go a little bit further. We actually know quite significantly that a lot of patients will actually associate effects or progressions within a condition, right? Say your disease is progressing and there's new symptoms developing, that people start associating that with the treatment and therefore don't take the treatment anymore, which makes those effects even worse. But by that point, they might not be manageable anymore, and you'll actually be in a very deteriorated state. Fundamentally, side effects are always unfortunate. I mean, we wish it weren't so, right? But a lot of these kind of side effects and unpleasant feelings are part of that. Again, what I just mentioned applies as well. Talk to your physician about that. It is really important to keep that person in the loop because there might be other options for you, but also there might be an additional explanation of how you can deal with that. If you've gone through that, or maybe I'm going to be honest, right? Maybe some physicians might also not be open to discuss it that way. Again, there is a lot of help out there. Specifically, I would highlight probably patient groups, patient forums. and so on, where very, very helpful, very, very helpful advice is being shared on how to deal with the condition. And a very large part of that is how to deal with specific side effects of medication, which sort of things you can use, which sort of nutrition you might have to pay attention to, which exercise regimen might apply to you, and what other remedies exist that could help you with something. So seeking out that advice, always being aware you're not alone. Someone had that problem. There's always good advice. Check that it's validated, but there's always good advice out there.
Great, great. So there's a lot of different theories and models out there about behavior change. And each of these has its own individual strengths and weaknesses, but they all share a common goal, which is to help people make healthy changes in their lives. And the stages of the change model is designed to help people understand what it takes to make a change and how to overcome any obstacles in their way. And it can be overwhelming to try to figure out which one is right for you. But I guess personally, I think that the best approach is to think what you want to change and why. And do you want to change your behavior because you feel like you should or because you really want to? And all you're trying to change, or are you trying to change your behavior for yourself or for someone else? I mean, once you have that understanding or the sense of motivation, then you can start to look at the different theories and models and see which ones make the most sense for you. So, can you talk about some of the most common theories and models about behavior change?
There's a lot of models out there. I'm going to specifically focus on a few that are relevant to healthcare, because behavioral change obviously is a more common topic, but in health some specificities apply. And I'm going to be honest, right? Most of them were developed. I'm pretty sure all of them were developed specifically for smoking cessation, because that was like one of the first ones when we started to understand. Okay, we see that, by the time that that it was clear that smoking is unhealthy for you. We see that people know it's unhealthy and they continue to smoke. So why is that, right? And how can you get people to stop smoking? Because again, just telling them to stop smoking does not work. Well, it works maybe in a few, but not in the majority of people. So one of the ones that you just mentioned is actually something that we like to call the trans-theoretical model. So it goes through a few stages of the change. It's one of the models that is built around a process rather than a basis. So the process itself goes through a few phases depending on the interpretation. But what you just mentioned is like a pre-contemplation phase. Maybe I should change this this behavior. You become aware of the fact that that behavior might be detrimental, might be bad for you. Then there's a contemplation phase where you consider, okay, I could change that behavior. What would make me change that behavior? Then you start thinking about changing the behavior. So you start planning some concrete actions. Then you actually go into the action phase. And then comes the most important part, that's the maintenance. Any behavior, and you need to be aware of that, any behavior you're trying to change is going to take time. This is not a quick thing, and you will have to stick to that. It's not necessarily interesting. It's not necessarily positive. But what you mentioned right in the beginning, I think, was very insightful. That you start slipping into these old habits. That's something you want to try to avoid. So you'll have to be aware that the maintenance of any sort of behavior is important. Typically, we like to think about it in terms of actually habit formation. So a habit is something that is, I'm using a scientific behavior definition kind of, but a habit is something that hurts you or that you don't find comfortable when you don't do it. So in the beginning, obviously taking medication is not a habit, because if you forget about it, you'll probably feel okay. You won't have, most people actually will feel fine, other than they're potentially progressing. But you want to form that habit, and forming a habit typically takes around 60 days. So if you have to take your medication, stick to it for at least 2 months. Again, health, as I pointed out at the beginning, right? Health not being necessarily one area where the feedback loops typically work. To form intuition, we typically say 3 to 4 months is a good sort of benchmark to think about changing your behavior. But you will have to stick to the sort of regimen consciously for that time, and then it will become easier. This is sort of the progression model, and then there's a lot of other models out there. I can give you another one that is fairly common in healthcare. It's called COM-B for capability, opportunity, motivation, behavior. So it basically outlines the fact that you will need the capabilities to change the behavior. You need to be physically able. You need to be able to physically do something. Say, go for a walk, right? Like you cannot do that if you're disabled and lying in bed, for example. You need to have the opportunity. So you need to have the chance to actually do that. Again, for a walk, you need to schedule yourself the time. You need to reserve that time. You need to be in an area where it is actually safe to go out for a walk at the time that you're planning to do so, and so on. And the last part is the motivation, and that is the part that you had highlighted just before. Who am I doing this for, right? Like what's the motivation that is underlying here? And then there's several sub-factors between that. But if all of these come together, then we have the chance to actually change behavior, and then we have the chance to actually move forward. These are just two of the sort of principles that you can apply, but there's a lot of different assumptions that go into that. We've actually developed one of the models ourselves, and it's called the SPUR framework, which basically combines all of these a little bit more. And we've done a lot of research into that. And here I can give you sort of the explanation for how that then actually impacts health behavior, because we need to be aware of that, right? That model is more looking at what are the underlying drivers that lead to negative health behavior, whatever that may be, right? That can be not taking your medication, it can be not going to see a physician, and so on. And we have a few different ones. That's actually the name SPUR is 4 different dimensions, SPUR. The S is social. So it is, as we mentioned in the beginning, very, very important actually to feel supported by your family, as well as to not fear the social stigma that is associated with the disease. These are sort of 2 fundamental drivers. If one of these is off, you're more likely to have not positive behavior. I'm trying to avoid the word negative here. Then there's psychological factors which we need to be aware of. There's things like, how do you respond to authority? So again, if the physician tells you to take your medication, how likely are you to follow that? That is an intrinsic trait that relates to how you behave. There is how you project yourself in time, because a lot of people will have, it's a typical marshmallow effect. I don't know if you know that, but it's the idea that I want a reward now. I want to live in the here and now because I don't know what's going to happen in the future. So taking my medication inherently doesn't bring me benefit now. Actually, as you mentioned, like it could have side effects. It could have something that I don't want to have right now. And then it's going to save me like a couple of months or years of my life, but 20 years from now. But I might be run over by a bus tomorrow. So what's that gonna do for me, right? Mm-hmm. So a lot of that comes in. And then fundamentally also, we mentioned that before, right? How much does your identity work with being a patient? How much can you incorporate that? Because a lot of people will struggle and will honestly not accept that they are a patient. If you don't accept that you're a patient, you're not gonna take your medication. It's quite simple. There's usage factors which relate to forgetting, financial issues, the self-efficacy of being able to take it, and so on. And then there's rational things that relate again to, did you understand your disease? Do you understand your treatment? Why you're taking them? What are the benefits? What are the risks? And so on. And all of these combined sort of provide you with a pretty holistic overview of what can be happening in a sort of behavior.
Mm-hmm. Thank you. Thank you for that in-depth explanation. No, that's great. I want to acknowledge our guest. Hey, Dr. Tazeen, I hope you're doing well. Thanks for joining us today. So, in your experience, do you think technology is empowering patients to make healthier choices? What do you think?
That is an excellent question. I was hoping we'd dive into the technological part. That's a double-edged sword. I have to be really honest. Technology has the ability to help people adopt behaviors. And I'm going to tell you that there's a few specific techniques that we can use, specifically the cognitive behavioral therapy. That is it's something that comes out of psychology. So it's a way of basically, when you classically picture psychology, you lie on, for example, a sofa or something, and you talk about your childhood and so on, until the psychologist figures out what is your underlying problem, what are you doing with it, right? Cognitive behavioral therapy is an alternative to that. It actually doesn't go that deep. What it does, it starts identifying, and it helps you identifying negative emotions, thoughts, behaviors, and replacing them. And that is something that is also shown work quite well digitally. So that means there are some good ways of adopting positive behaviors by following some digital advice. Now, the reason I said that's a double-edged sword is there is a lot of tech solutions out there that are not optimized for behavior change specifically, for various reasons, right? Not following the quite the same advice. So we have to be a little bit careful in how we use them. The right technological tools definitely empower patients to change their behaviors, and more importantly, they can also help the healthcare professionals help with that behavioral change, because I think that's another part that is very, very common, right? Like if you go to your GP, or if you go even to your specialist, they're not trained to teach you how to take your medication. They don't have the time, they don't have the capabilities to deal with that, and then you can often be lost. So technology really provides an alternative here for a lot of people that are engaged with that.
Mm-hmm.
But we also have to be honest, that doesn't apply to every patient. So we have to be a little bit conscious of the fact that these are not absolutes. But yeah.
True. We just touched on two things: technology and the cognitive behavior approach. I want to do a little deeper dive on the cognitive behavior. Then we have a whole section on the technology. Now, you
Sure.
mentioned that cognitive behavior approach treatment is a form of therapy that seeks to identify and change negative thought patterns and behaviors. It's based on the belief that our thoughts, feelings, and actions are interconnected, and that by changing our thoughts, we can change our behavior. So, what is it used in treating? Is it like used for mental health conditions, anxiety, depression, eating disorders? And I guess, how does it relate to chronic conditions? Can you talk about in detail about cognitive behavior approach to treatment and provide some examples?
Absolutely. No, I'm really happy to. It's a really fascinating concept. So originally it is, I think, developed for mental health disorders. And that is also where digitally, by the way, it is used mostly today. The idea though, right, is more or less the same, because when you think about the mental health kind of issues, fundamentally, if we talk about what such patients would need, or what the people would need that suffer from these conditions, is a way to cope with the decisions, the condition, right? You need coping strategies. You need ways to mitigate or any sort of negative impact that it can have on your life. And fundamentally, that's actually not that uncommon when we talk about chronic conditions, because we mentioned at the beginning, right? You are a patient now, so that will become part of your identity, whether you like it or not. And nobody does like it. So that can create a lot of these negative emotions, and the things that are from the thought patterns actually pretty common to mental health disorders. It is also not uncommon for someone with a chronic condition to develop depression based off that chronic condition, right? That is something that definitely can happen. And because of these thought patterns being the same, you can actually treat them more or less the same. So you can actually look into what is it that does stop me from taking my medication. That is the same negative kind of thought. You're afraid of the side effects, right? That is something like in depression, for example, you would be afraid of a spiral. You would be afraid of something happening in your life that just gets exacerbated in your head. And that's the sort of thing that also will actually cause you not to take your medication, because you're afraid of the side effects. You will not take your medication, which might make these side effects better or worse, but the fear won't go away. So you need to replace that fear and these thought patterns with something that is a little bit more positive, that you can associate with something that is more positive, and that will help you cope with that. And the principles here are actually not that complicated. The reason it works so well digitally is because it is fairly self-taught. Things like setting achievable goals. So you, again, it goes in the motivational part, right? Setting these achievable goals can help you overcome specific obstacles. It can be things like mindfulness, so meditation and just being aware of what you're doing, controlling and learning learning gratitude, non-judgmental, being not non-judgmental, and so on, right? These are concepts that are fairly easy to incorporate, and when they are incorporated, they will also help treating specific chronic problems with following treatment plans. Let's put it this way.
Hmm. So we talked about behavior science can help create and customize therapies. And I'm going to ask you about nudges. What is a nudge and how can nudges encourage healthy behavior?
Excellent question. So nudges is something that actually earned the book Nudge actually earned a Nobel Prize. I forgot when, a couple of years ago in economics. It's a pretty fascinating concept. And nudge is coming from the assumption that people should take a positive decision, but they won't because of certain biases that they're going with. So a nudge is basically a way of helping someone overcome a bias by presenting the possible potential decision to them in a different way. That's a fairly theoretical concept. Classically speaking, I think one of the key examples that's actually also highlighted in the book is, and it relates to health, is in a buffet when you're getting food, whatever comes first is more likely to fill up a large part of your plate. So now pay attention, because most of the buffets actually do it now, that the healthy choices come first. That is a way, like, something has to come first, right? If we put the hamburgers first, then hamburgers are more likely to end up on your plate. If we put the salad first, then salad is more likely to end up on your plate. So a nudge is basically making that I need to make a decision, so I am placing the healthy option first. That is just one example of a nudge. Fundamentally, a nudge is building on the bias, right? The bias, what I mentioned in the beginning with, like, you touch the hot plate, you're not going to think about that hot plate. So you might want to either use the fact that somebody's not thinking about doing something, like placing it first, or you want to phrase it in a way that will actually make them think about it. Because the moment you start thinking about it, you actually make pretty good decisions. It's just that we usually don't think about it that much. When we think about nudges, I think in healthcare, and this is pretty interesting, I can give you an example here. Because I actually did that. This is, by the way, not scientifically accurate. It was about, I talked to a friend about how you get people to sleep more, because sleep deprivation is actually a pretty common problem. And it is something that is actually linked to all of the chronic conditions we're talking about. And a lot of the times, actually, a lot of the chronic conditions will depend on you sleeping well and sleeping enough, because that is when your body heals. So if you want someone to sleep more, right? Say the optimal time is 8 to 9 hours of sleep every night, and you have someone in front of you who sleeps like 6 to 7 hours, so coming 2 hours short. Now you tell them, again, this is not scientifically accurate, 2 hours that you don't sleep every night will take away, or will end up being 2 hours that you don't have at the end of your lifetime. Now, the way you phrase that is quite important, actually. If I tell you, for example, every hour that you sleep additionally now will add to the end of your lifetime, that's a pretty enticing concept, and it makes you want to wonder, that's okay. If I phrase this now differently, and this is where the nudge comes in, and I tell you every hour that you don't sleep at night now will take away an hour from your life at the end, that's much more compelling. about twice as much, to be honest. So
Mhm.
this is a way you can actually nudge someone into taking a more positive behavior. There's a lot of different sort of concepts
You're
that exists.
compounding the compelling, how compelling it
Yes,
is.
exactly. Um, we also have to be aware, by the way, that nudges need to be tested. It's not like someone can just easily say, "Oh yeah, if I phrase the question this way, then it's 100% going to be better." Which is why nudges are really, really difficult to sort of use in your private life, and actually, when you work with someone who you're trying to, or when you're like at home with a patient and you're trying to nudge them, be aware that some of the nudges are going to fail and some are not going to land, and some are going to land. By the way, I realized that now after reading the book. I nudged my father into stopping to lick his knife when I was like a really little kid. Told him to stop it, he didn't. Told him I was worried, he didn't stop it. Painted a picture with him, like, I mean, I was like 4 years old, so it wasn't a good picture, with him cutting off his tongue.
Mhm.
That got him to stop.
Yeah.
These are the sort of nudges that you just have to be that you can use in order to go there. There's a whole range of them, right? Like you can highlight a gap when someone has a certain behavior, and you ask them, would you recommend that to your child? Would you recommend that to your parent? This is something that can happen. Phrasing things negatively, highlighting the risk that is associated with something. These are all things that will end up influencing behavior in a way that might be more healthy if they're presented that way.
Great.
By the way, it's also important to highlight that a nudge can only be used in the positive direction, not in the negative. So
Hmm.
I cannot nudge someone into something that will be bad for them, because by the moment they start thinking about it, they will realize that it's bad for them, and that actually destroys the nudge.
I see. Okay, wow. I have to remember all these things. These are very good things when you're raising children as well, providing these
Yeah,
nudges, right?
I'll remember that. Thank you for pointing that out.
Well, because I have issues with my daughter's sleeping habits. She doesn't sleep enough.
Fairly common
Being,
problem, yeah.
and not eating healthy enough, that's a separate topic, but we'll just stay on this scope of the conversation. So let's talk about digital channels, okay? And I think this is what Dr. Tazim was referring to. So, what do you think are the benefits of using digital channels to follow doctor's recommendation for healthy lifestyle?
Um, so fundamentally, I think I mentioned at the beginning. I think the most important part to keep in mind is that digital is a great opportunity to provide alternatives, because I think the most, we often think like whenever we talk about like healthcare transformation and like digital and so on, people start being scared, and you can actually see that. People start being scared of like envisioning, okay, you go like to the hospital and you're not seeing a single person anymore, and like you're in there, and the same thing goes, right? Like you're getting your diagnosis from a computer that will tell you to do something, and then you'll go home with your app that will constantly remind you to take your medication and so on. That's not going to be the future, because the way you feel about that now is not going to change how people are going to not going to change how people feel about that in the future. Um, So it provides a really great alternative, where someone has access issues, where someone can't get to where someone can't get to a certain specialist, or where someone can get there, right? If your physician gives you specific advice, and then as I mentioned, you need to talk to that physician at some point because you're scared of it, or you want to talk because you realize there is a problem that might need help. You want to talk to your physician, but now you're in a position where that physician might be 3, 4, 5 hours away one way with your car, right? And you cannot just like take time off your job, because obviously the visiting hours are only during your working hours, which doesn't help. So that's a significant barrier.
Mhm.
So digital now opens up that entire possibility of opening up a chat. I mean, it starts with email, but like we know by now that also WhatsApp and other messaging services work in that way, right? So you can have like an asynchronous, so timed conversation with the physician when they are available and when you are available, that can actually help you. So opening it up that way is quite important. More importantly, there are a ton of tools out there already that can help you with that. If you continuously forget your medication, you can use reminder tools, right?
Mhm.
Apple just released one, but there's really great ones out there already. Um, obviously, if you make a conscious decision not to take your medication, then reminding someone won't help. But there's a lot of examples like that. There can be examples like, as I mentioned at the beginning, patient forums, right? Otherwise, it might be really hard. Even though there are so many chronic patients, it's a little bit hard to maybe connect with a lot of them and find the ones that maybe you can relate to most, right? But digital opens up the entire possibility to now actually ask for help from a lot of different people at the same time, that maybe you find some people that share some common insights with you and that can actually help you.
Mm-hmm.
All of these are great opportunities, but again, I want to stress, like, these are alternatives, right? Like, we have them in the classical sense where you can find these people, you can talk to these people. It's just that maybe right now or in the past, there was more of a barrier to doing so.
Mm-hmm. So, how do social and behavior variables factor into selecting a digital channel for healthy behaviors? What do you take on that?
So social, I mean, it depends a little bit what the issue is. I think the thing that I want to stress again is, you mentioned at the beginning, but every person is different, right? We know that. That's why things where a lot of personalization is involved, like Netflix, like Amazon, like all of the services that you think of, they work so well because everyone will be a little bit different, and that will mean everyone will need a little bit different things. So if you think about the way of digital, right, it is important to understand that the inherent drivers and the inherent underlying concepts that you have are going to be important to take into consideration because not everyone will have that same situation. So in a social setting, for example, I can give you the example of someone who is more personal to me, but someone who might have some mental health issues, not wanting to go to a psychologist, right? Because of the stigma that's associated to that. Now, digital can actually, if you start looking, offer you a complete alternative. There's chatbots out there that will treat depression, anxiety, post-traumatic stress, and so on. Again, by the way, by cognitive behavioral therapy that we already talked about, without you bringing a human in the loop. They will help you without coming into that. So from the perspective of, like, if you're afraid of the sort of social interaction, digital can provide that alternative where access otherwise for you personally would be difficult because you would be uncomfortable. In the sense of, like, the behavioral things, I think there was a tool that was presented this week. That's why I'm thinking about it. But if you're too busy or you don't see yourself at risk or something, right? There's a convenience play that can be made here. For example, mammograms, right? Like, any woman above, well, it depends which country you're in, but above a certain age should be checking their breasts for lumps and so on. And that's something that is difficult to do, and you will have to schedule a physician visit, which means there's already a barrier here because not everyone will be comfortable or have the time to do that, and so on. So an easy solution in that case, if you start realizing, okay, I don't want to do that, but I am worried about it, is to find, as I said, there's one specific device with which you can scan the breast, again, without anyone else being in the loop, that you can do yourself. And as soon as there is an issue, you will be linked to a specific doctor that will actually help you with that. So there are some great tools out there that are improving access and that can actually help you. You will have to find them, but it is important to understand what is your specific challenge that you're trying to solve, and then you can start looking into which tools actually exist.
Mm-hmm. What problems do you think doctors confront when advocating and helping patients adopt healthy habits digitally?
Um, Yeah, so the one I'm going to echo the one that I just mentioned. It's a doctor, and I mentioned that at the beginning. We actually know that adherence, for example, is something that doctors are inherently bad at finding in their patients. They constantly overestimate adherence, or misdiagnose adherence. So it is difficult for doctors to identify what are the underlying trends. Now, because it is difficult to identify the underlying trends, it is obviously difficult to make a specific recommendation about something that might be helpful to that patient, right? because we are not in a realm where we have like this one digital solution that solves everyone's problem. And we're probably never going to get that, or not for a very long time, because that is very, very complex to do. So the first part is the physician or the doctor might not understand what would be best for the patient. And taking the time to find that out with limited capabilities is probably not really worth it. The second part is a thing that many digital or technology people underestimate is the fact that a doctor is used to a tremendous amount of work that has been done on any intervention they're using. So any drug they're prescribing, they're relying on a ton of research that went into that. And a lot of patients who will have gone through this exact situation from a condition perspective before that the doctor can rely on. Any technology company sort of uses different kind of metrics to improve that. There's obviously some things that are going with that, but creating the same amount of what we can call evidence, so research that is being done affirmatively, uh, is just missing. And a lot of the times it is missing, and it is hard to stay on track of that. So from the doctor's perspective, they are less likely to prescribe or recommend any sort of such solution, because in their eyes, it is not as proven as the therapy itself. And from that perspective, it is a little bit more difficult. And then the third part is the sheer volume, right? The sheer volume that comes out with what it is that you could recommend. It is difficult enough for a doctor to stay in their specialty, to stay on top of all the new drugs and all the new developments and guidelines and recommendations that are given. That, I think, I've heard that just recently, right? Like that is way more, like it takes you probably 26 hours a day to stay on top of things. And that's not even taking into account that you technically have to treat patients still. So that entire volume and the ease with which you can actually launch a digital solution exacerbates the problem, because that actually means there's more things to choose from, which means there's less of a likelihood of adoption of a good solution. That is something to change. And then there are some patient's intrinsic things, obviously, like digital literacy and so on, that is pretty difficult to solve for.
Mm-hmm. Thank you. Thank you so much. So we have just a few more questions until time is up here. So
Sure.
now, for people who are unsure about using digital channels to follow doctor's recommendation, what advice can you give them?
Okay, I'll try to keep that one really simple. Try. Seek help out. Seek out the digital channels, because it is a really great way to access. And the beauty of digital is that you can just try and stop, right? There's a little investment that you will need to put in up front. So the hurdle for you is pretty low. Be aware that digital health solutions are designed for specific issues, and that might, even though on the cover they might look the same, they might not be the issues that you're looking in, right? They might not really feel comfortable to you. And that's okay. If they don't feel comfortable to you, drop them away and try another one. It is really important to understand that sort of you will find that sweet spot, but you will have to find that sweet spot in order to go through a little bit of an adoption there as well. But key message is try, seek out what exists. Again, rely on other patients, for example. Rely on recommendations that you can find. Try, and if it's not for you, it's not for you, but give it a chance.
Mm-hmm. Great, great. Well, thank you so much. Your expertise, your time to share on this very important topic. Do you have anything else that you would like to share?
No, I think thank you so much for the conversation. I think it's a pleasure to talk about these topics, and I think again highlighting the fact that health behavior is complex, and we have to be aware that it is complex, and it is actually one of the more severe problems that we face in society, the negative behaviors, because of the growth of chronic conditions that actually result also a lot of the times from negative health behavior. So it is really important that we pay attention to the topic, and that we use any sort of awareness that we can get for that. Thank you.
Thank you. Thank you so much. Well, the baby boomers are the first generation to have access to incredibly effective medical treatments and technologies that have allowed them to live longer than previous generations. But at the same time, they're also the first generation to face significant challenges when it comes to their health. Things that we mentioned already: diabetes, obesity, heart disease, all of this are on the rise in this population. And these chronic diseases are often caused or made worse by lifestyle choices like diet, exercise habits, and so forth. Behavior science is really about trying to understand how we can help people make better choices for their health, especially as they age. And it offers us a roadmap for success. And with enough patience and effort, we can overcome obstacles and achieve our goals. So if you're struggling with chronic illness, don't give up hope. And remember that change is possible. And with the right mindset, you can achieve your goals. And thank you so much for tuning in today. Next week's event, Monday, 11 a.m., we're going to be discussing about don't let the legal issues of aging catch you by surprise. And then later in October, we will discuss one, how baby boomer entrepreneurs can create a digital brand to attract their ideal customers. This is for business owners, whether you're a baby boomer or not. Two, how baby boomer entrepreneurs remain competitive in the digital age. Thank you so much for tuning in today, and I'll see you next week.